Good evening, everyone. Welcome to our Zoom class. Today is Thursday, December 8th. Today is the beginning of chapter 14, the integumentary system. Remember that this is being recorded, so you can go back and watch the video for any updated information you might need. Next week, on next Friday, which is, I think, the 16th, December 16th, is our last day of class before the break. We have a 2-week break. We return on January 3rd. Your assignments, even though Friday is the last day, you still have until Sunday to turn in your labs and any assignments you haven't completed. I will be giving some extra credit assignments for the break and some helpful information just to keep you busy so that you don't forget everything you have learned during this 2-week break. So you will have some extra credit. If you want to complete the extra credit assignment, you can. And I'm going to give some NCCT certification information so that you can review and practice. So when it's time for your certification exam, you'll already be ahead of the game. So we're going to go ahead and get started. Remember, this is recorded. Chapter 14, the integumentary system. I'm going to go over the learning objectives for this chapter. This exam is on either Tuesday or Wednesday. You will be having this chapter 14 exam, and then you will be having a chapter 15 exam possibly on that Friday. I'm trying to see if I'm going to give the two together or if I'm going to give one separate. So just remember to read your PowerPoint slides. Your PowerPoint slides breaks down the information. It makes it much easier for you to understand. So make sure you always read your chapter, but if you're having difficulty with understanding the words and the verbiage that's in the chapters, please make sure that you review your PowerPoint slides. Again, that's in your grade section of e-learning. All of the PowerPoint slides for this module is in the grade section. So I'm going to go ahead and get started with the learning objectives. The learning objectives for Chapter 14, the integumentary system. The first one is describe the format of the integumentary system in the CPT manual. Number 2, identify the elements of coding skin, subcutaneous, and accessory structure services. Objective number 3, review the main services in nails, pilodontal cyst, and introduction. Number 4, identify the major factors in repair. Number 5, state the important coding considerations in destruction and breast procedures. And number 6, demonstrate the ability to code integumentary services and procedures. For those of you, the new students who just started, I know that you're not familiar with the coding, but we do have links in the e-learning, CPT links for you to look up codes and your ICD-10 codes. You can go back and review in the earlier chapters the basics of CPT and the basics of ICD-10. Remember that you're going to come back around to those chapters when you come back in your Ferris wheel module. And I will not give you just a 0 if you get those codes wrong because you haven't gone over that information. So I'll be very lenient when it comes to the coding. But you do have the sites in your e-learning in the grade section to review the codes and get the codes. So the first thing we're going to start on is integumentary system. The integumentary system subsection includes codes assigned by many different physician specialties. There is no restriction in who reports the codes from this or any other subsections. So if you're really reading into the information, that question on what we just read answers your quick check 14.1. That first little sentence answers the question for your quick check 14.1, where it states, dermatologists are the only providers who utilize the codes in the integumentary system, subsection of the CPT manual. So is that true or false? Is that true or false? Someone answer. I just read.
False.
It's false. And why is it false?
Okay, now you got me with that one. Let me think.
I mean, look at it. It's okay. That's why
I don't have my book open.
Let me see.
Miss Geneva. Really?
Oh, let me look.
Open your book, Miss Geneva. We're in chapter 14. You're on mute, Miss Geneva.
Well, my bad. I had just walked in the house getting off. I'm gonna go do it right now. Get out the way. Get out the way.
Yes,
Go.
get your book.
Yes, ma'am. I'm getting to it now.
So I just
Dog,
read
I'm
that
going.
first part, Heather. It states the integumentary system subsection includes codes, and listen to that keyword, by many different physician
Yes.
specialties. There is no restriction on who reports the codes from this or any other subsections. And then the quick check number 1 stated, dermatologists are the only providers who utilize the codes in the integumentary system. So the reason it's false is because it states many different physician specialties, and there's no restriction on who reports the codes.
Right.
So that is why it is false. So when we say things are false, just make sure that when you're reading, you understand why it's false.
Yes, ma'am.
And it says, okay, so it says, you may find a family practitioner using the incision and drainage, debridement or repair codes, a dermatologist using excision and debridement codes, a plastic surgeon using skin graft codes, or a surgeon using breast procedure codes. You will learn about the integumentary system subsections by first reviewing the subsection format and then learning about coding the services and procedures in the subsection. So again, it states, quick check 14.1 states, dermatologists are the only providers who utilize the codes in the integumentary system subsection of the CPT manual, and that answer is false. So as I always state, when you're reading your questions, the information and the answer is always going to be before that question is presented. So always just make sure that you're reading, like read your question first. And then as you're reading, go back and then you will be able to get that answer. So the format of the integumentary system. The subsection is formatted on the basis of anatomic site and category of procedures. That is a test question, so you might want to highlight that. The subsection in the integumentary system is formatted on the basis of anatomic site and category of procedures. That is a test question. For example, an anatomic site is neck, and a category of procedure is repair. So the repair of the neck. The subsection integumentary contains the subheadings: skin, subcutaneous and accessory structures, nails, pilonidal cyst, introduction, repair, closure, destruction, and breast. That's one of your questions on one of your assignments as well. The subsection integumentary contains the subheadings, and that was your subheadings. Each subheading is further divided by category. For example, the subheading skin, subcutaneous, and accessory structures is divided into the following categories. So remember, the subsections are divided into anatomic site and category of procedures. So the category, the accessory structures, now we're going into introduction and removal, incision and drainage, debridement, paring or cutting, biopsy, removal of skin tag, shaving of epidermal or dermal lesions, excision, benign lesions, and excision, malignant lesions. So this will give you the answers to several of your questions in your assignments, the format in the integumentary system. Next, we have introduction and removal. That code range, so when you're looking in the integumentary system for that code range, remember that the code range is from 10030 through 10036. Only in that section will you find introduction and removal. It says code 10030 is assigned to report percutaneous image guided fluid drainage of a collection, such as an abscess, seroma, cyst, hematoma, or lymphocele from soft tissue. And you're going to have diagrams, and I'm also going to put in your assignments, as for in your labs, some diagrams for you to label so that you can get a better understanding of what it's talking about. Because when they're giving you this documentation for you to code, you're going to need to know some of the terminology and know what it is to get the correct coding. So next it says incision and drainage. Incision and drainage, which is going to be I-N-D. They're not going to have in documentation the word written out, incision and drainage. You're going to have all of these abbreviations. So it's good to know your medical abbreviations and terminology. When they're giving you that chart, it's going to say I-N-D. So you need to know I-N-D is incision and drainage. And those codes are 10040 through 10180. They are divided according to the condition for which the I-N-D is being performed. Acne, surgery, abscess, carbuncle, boil, cyst, hematoma, and wound infection are just some of the conditions for which a physician uses I-N-D coding. Debridement. Debridement is the removal of infected, contaminated, damaged, devitalized, necrotic, or foreign tissue from a wound. So whenever, basically, more simpler terms is if you're digging something out, basically. If you're taking it out, that's debridement. Excision debridement. So there's regular debridement and then there's excision debridement. Codes in category 11000 through 11047 describe services of debridement based on depth. So excision debridement is on how deep that actual wound is. So that's the difference between regular debridement and excision debridement. Excision debridement is the depth of that wound, of that incision. And it says body surface condition, and for 11004 through 11006 by location. The first debridement codes 11000 and 11001 are reported for eczymatosis debridement, eczema. Eczema is a skin condition that blisters and weeps, as illustrated in figure 14.2. So in your labs for this week, you're going to see I have some pictures for you all, and you need to tell me what type of incision, excision, or drainage it is. If you all haven't got to your labs yet, that's due on Sunday. I have some diagrams in there for you to review and look at. So coding shot. Remember to always read your coding shots. It gives you helpful information. It says some surgical procedure codes include debridement as part of the service. You may report a debridement as a separate service when the medical record indicates that a greater than usual debridement was provided. For example, if an extensive debridement of an open fracture was performed when usually a simple debridement would be performed, you report the additional service using a debridement code from 11010 through 11012. So you would add that additional code because they might state that it was going to be a usual, just 1 centimeter, but then they realized after looking at it, it was deeper or bigger. So you would also code an additional code for that service. Introduction to lesions. Before you learn about coding the various methods of lesion, destruction, and excision, you need to review a few rules that apply to this commonly performed procedure. After you have learned the general lesion information, you will review each of the destruction and excision methods. So you have a whole list of CMS rules. Become familiar, you're not going to remember those, but become familiar with those rules because it's important, especially when you're coding for anything dealing with incision, excision, debridement. So just make sure that you read over those CMS rules. Then my book is different from yours as far as the page numbers. So on page 377 in chapter 14, there are 2 columns of different type of tissue and skin tissue. Make sure that you review those. That'll help you also with the diagrams that I provided for you all. Also, make sure you always read your caution. Everything that's in red in caution, make sure that you always read. That's giving you helpful information. It says caution. Destruction of lesion destroys the lesion, leaving no available tissue for biopsy. Therefore, there will be no pathology report for lesions that have been destroyed by laser chemicals, electro artery, or other methods. In these cases, unless a biopsy was performed prior to destruction, you will have to take the type of lesion from the physician's notes only. So that's very important to know. If it was done by laser or biopsy, you will not code that. You're going to code from what the doctor's notes state. That's how you would code for anything that has been done through laser surgery. Pairing or cutting. Pairing or cutting codes 11055 through 11057. So what page? I know most of you have 2022. So for me, where it states figure 14.7, which page is that on in your book? It's on page 379 for me.
378.
Okay, that's showing figures 14.5, 14.6, and 14.7.
Hold on, let me go back. No. 14.5. I'm going up. It's 378, yeah.
Okay, so in my book, it's 379. So make sure that you become familiar with those diagrams. It's just showing you the difference. A and B simple closure, and it's showing you different things. Intermediate, 2-layer closure, figure 14.7 is just showing you the different type of lesions they are. Then it states at the bottom, biopsy. Biopsy is a term applied to the procedure of removing tissue for histopathology, study of microscopic tissue changes. Removing a tissue sample of a lesion may be needle aspiration, needle inserted for sampling of cells. Incisional biopsy, open, sharp, and partial removal, or by incisional biopsy, complete removal. You would not report both a biopsy and an excision performed at the same time as the biopsy is bundled into the excision service. And that would be in the documentation when you're reading your notes. For CPT lesion biopsy codes, only a portion of the lesion and some of the surrounding tissue is removed. The section of surrounding tissue, which is the margin, is included so the pathologist can compare the normal tissue to the lesion tissue and note the differences. Again, in your caution section, it states, do not assign modifier -51 with these biopsy codes. And it's telling you the different codes that you wouldn't use to use a modifier. And you'll have that, all of that are being documented, and depending on what specialty you're working in, you'll have more information about that. Skin tags. Skin tags are flaps of skin, benign lesions that can appear anywhere, but most often appear on the neck or trunk, especially in older people. Skin tags are removed in a variety of ways: scissors, blades, ligatures, electrosurgery, or chemicals. Scissor removal of a skin tag is illustrated in figure 1410. So if you look at figure 1410 in your book, they're showing how they will remove that skin tag with scissors. Scissoring is often used for tissue column lesions. The forceps grasps the column and the physician snips the lesion off at its basis. Next, we have shaving of epidermal or dermal lesions. Read through that. You'll always have documentation to go through this. So coding shot, make sure, like I said, they have a lot of coding shots with the integumentary system. It says you are not to assign the shaving codes if the shaving penetrated through the dermis. Full thickness shavings are to be reported with the excision codes found in the excision, benign lesion or excision, malignant lesions. So all of these coding shots, and like I said, it will be documented. You'll know more when you're doing it, that if you are to code and how you need to code. But you need to be very careful, because that's where fraud kicks in if you're coding more than what you're supposed to code or adding information that's not documented. It says the codes in the excision benign lesion category are based on the location of the excision. Examples: trunk, scalp, ears, etc., and the size of the lesion. The next coding shot, an excision of either benign or malignant tissue, focus on the dimensions of the normal tissue margin excised with the lesion. This normal tissue margin is a determining factor in selecting the correct CPT code. Make sure, again, like I said, you're reading through the chapter, you're looking at your examples, you're looking at your diagrams. Everything is going to be documented when you're coding. They're going to have the dimensions and everything in the documentation and the notes. Next, they have excision malignant lesions. So look at those diagrams on figure 1413 and figure 1412. Just make sure that you're reviewing those diagrams. So I'm going to share my screen and we're going to go through some of the PowerPoint slides, which will make it much easier for you all to understand. So I'm going to share my screen with you all. And we're on chapter 14. So reading your PowerPoint slides makes it much easier. And like the first slide states, it says integumentary system, often used in all specialties of medicine. So when you're looking at your assignment and you're reading your questions, majority of the answers are in your PowerPoint slides. Not just surgeons or dermatologists, wide range of physicians. Next, it states subheadings of integumentary subsection. What we just went over in the front, they tell you all of the subsections. That's one of your questions in your assignments. They're giving you pictures, introduction, removal, and incision drainage. So when you're looking at your diagrams in your labs, make sure that you're reviewing your PowerPoint slides. It gives you information. Introduction and removal, it gives you the code range. It shows you about incision and drainage. And you see how they have it here, I and D. Incision and draining of abscesses, carbuncle, boil, cyst, infection, hematoma, and it's showing lancing, which means cutting of skin, aspiration, removal with needle. So they're giving you the examples and showing you on what it looks like, and it shows you in the book, and it's saying figure 14.1. So make sure that you're looking at the diagrams and seeing what each thing stands for. Excision debridement. And it tells you what that is. Dead tissue cut away and washed with saline. That's what excision and debridement means. And it tells you the code range for what it is, like for infected tissue, including muscle and fascia. On here, subcutaneous muscle bone. So each thing, when you're looking the code, it tells you what section you need to be looking through, and it has the whole code range. Excision of lesion is telling you size is taken from physician notes. So you would get the excision of a lesion from the physician notes, not the pathology report. Storage solution shrinks tissue. Margins, healthy tissue are also taken for comparison with unhealthy tissue. So you would get this from the physician notes, not the pathology report. Lesion measurement. These are examples of lesions at widest dimensions plus margin at narrowest width. This is how you would be able to tell on what section and how you would be coding. When you're looking in your coding book, when it's time to code, you're going to see they're going to have 1.0 centimeters lesion with 0.5 margin left. And when you're coding in the code book, it's going to say those dimensions. So that's how you would be able to get your code. Lesion pathology. All excised tissue pathologically examined. Destroyed lesions have no pathology samples. Example, laser or chemical. These are the codes you report for destruction. Remember, destroyed lesions have no pathology samples. That's a test question, true or false. Lesion closure, simple closure included in removal. And it's showing here it's reported separately. Layered or intermediate. And it's showing you examples, local anesthesia included. This is also in your book, so just make sure, like I said, for better understanding, look here, it gives you a better and a more clear picture of what they're talking about. Paring or cutting. Removal by scraping or peeling. So paring or cutting, this is the code range, is the removal by scraping or peeling. Examples, removal of corn or callus. And it has codes indicate number 1, 2 through 4, 5 plus. Biopsy, tangential, punch, incisional biopsies. Not all of lesion removed, all lesion removed. Do not use modifier -51, which I just read earlier. Codes indicate number 1 in each additional. So just showing you how when you're reading your PowerPoint slides, it gives a clearer picture. It breaks it down so that you can understand it better. Skin tag removals. Benign lesions removed with scissors, blade, chemicals, electrosurgery, etc. Do not use modifier 51 when you're using skin tag removals. Codes indicate numbers up to 15 and each additional 10 lesions of part thereof. So when you're looking in a CPT manual, it's going to show you and tell you how many skin tag removals. So it says codes indicate number up to 15, and then it'll have each additional. When you're looking in your NCCT packet, for those who were here early with us, we went through some of these examples with skin tag removals. Shaving of lesions, this is the code range. Lesion is removed, but it's not superficial and does not extend into the fat. Removed by transverse incision or horizontal slicing. Just giving you examples. So I'm just going to go down some. Introduction, types of services. Lesion injections, tattooing, tissue expansion, contraceptive insertion removal, hormone implantation services, insertion removal of non-biodegradable drug delivery implant. Showing you examples on how that's done. You would have to code that. Repair factors in wound repair. It has on here repair simple, sum of length of repairs for each group of anatomic sites. Simple, repair of superficial wounds of scalp, and then they have a length of repair. All of this would be in your coding guidelines. When you're trying to code, they would have the centimeters. So that's how you would code, by the length and the width. Types of wound repair. We went over this, but this is just giving you a better and a clear picture. I'm just moving along on some important stuff. Information needed to code graphs. So when you're coding for graphs, this is the information that you would use. Type of graph, if it's adjacent, free, flap, etc. Donor site, recipient site, any repair to donor site, size and material used. Split, thickness and full thickness graphs. Graph type, this is an illustration. They're showing you the difference in the thickness and the width of the skin grafts. So as you can see, integumentary system goes very, very detailed because it's the skin and it goes just the dermis, the outer layers, the inner layers. It's so many different types of information and different things that you can code on in the integumentary system. Flaps. Burns. Codes are for small, medium, and large. Most calculate percentage of body burn, often require multiple debridement and redressing. It's based on initial treatment of first-degree burn, size, report percent of burn and depth, Lund-Brider classification of burns. Proportions of children differ from adults. So that makes a big difference in the children and adults. Mastectomies, based on extent of procedure, such as simple, radical, modified radical. Bilateral procedures use modified -50. Implant insertion billed separately. So this is all of the information. Like I said, you'll have additional information once you're into that specialty. You'll feel better about it. But these are the things that you would need to know. And just make sure that, like I said, you're reviewing your PowerPoint slides, you're reading through the chapters, you're looking at your questions, and the answers are always before the questions. The questions are a summary of what you have read. So make sure that you're reviewing your chapters, reading the PowerPoint slides. This exam for chapter 14 is either Tuesday or Wednesday. I'm still trying to decide if I'm gonna combine both, since next Friday is the last day of class until we return on January 3rd. Remember, you will have assignments that are due. You'll get extra credit, just some things to keep you busy, not too busy because it's the holidays, but something to keep your mind working so you don't forget everything you have learned. Also, remember, we're having the attendance contest. So please make sure that you try to complete your daily assignments daily. Turn in some form of assignment daily so that you can get something. Home office is giving out prizes. So we're just trying to see and make sure that you turn in assignments daily. It's every 2 weeks we're doing an attendance contest. So now the floor is open for questions. Any questions or concerns or information you might need in reference to your exams, information. Remember that I do one-on-one tutoring sessions if you're having difficulty, if you're not understanding, if you want that one-on-one assistance, just contact me. We can set up a time to review and just go over things one-on-one. So any questions, concerns? Heather, Geneva, Kayla, Samara, nobody wants to talk to me?
I don't have any questions now.
Okay.
No, I'll call you, I'll text you or bug you, but I can't think of anything right now. But I'm sure something will pop up.
Yes, Miss Geneva, I know you'll give me a call.
I will.
Kayla, what about you, Kayla?
I'm okay right now.
Okay, and don't forget, we have that exam that's due on Sunday. So make sure you all complete your chapter 13 exam. Samara, you're being very quiet today. You at work?
Yes, ma'am.
Okay, you have any questions?
No, ma'am.
Okay, so this is being recorded, so you all can go back and review, but I cannot stress enough to make sure that you all are reading your PowerPoint slides. It's so much simpler to go over those PowerPoint slides, especially if you're having, some concerns with the medical terminology that's in the chapter. The PowerPoint slides breaks it down for you. Remember, I am available. Do not feel like you cannot ask me any questions. Text me, I will respond. Email me, give me a call or whatever. I will respond. If I don't respond at that second, I will respond by the end of the day. Or if it's late, remember on Monday through Thursday, my office hours are from 8 a.m. to 4 p.m. I mean, Monday through Friday, my office hours are 8 a.m. to 4 p.m. On Fridays, I'm sorry, it's 4 p.m. But like I said, I do work after that time on Monday through Thursday. If you would need to do a one-on-one session, or if you need some extra help, I am available after 5 o'clock on Monday through Thursdays. On Fridays, I'm not available after 4 p.m. But if you need any assistance up until Monday through Thursday, up until 8 p.m., I am available to assist. We can do a one-on-one Zoom class, Zoom session, something you're not understanding, you just need an extra help, or even if there's a question that you want to ask and you want to do a Zoom class, we can do that. I am available. And remember, if you text or call me on the weekends, I will respond on Monday morning. A lot of times I'm checking assignments on the weekend or on Sundays, but I'm not responding until that Monday on the weekend. I'm just checking like exams or, different grades and assignments, but I will respond on that Monday morning. So I can't say it enough. We have to communicate. I'm not a mind reader. You have to communicate if you're having any difficulty. So this is being recorded. Once it's recorded, I will place it in news and announcements. I will also have it in, matter of fact, let me show you all, because a lot of times I know that you all don't realize that this information is in your gray area. So on here, I have chapter 13, mini lesson 1. And I post everything in the sections here. Like this was chapter 13, mini lesson 1. This was chapter 13, exam 2 review. So you can get this information also when you click on in your lessons. Chapter 12, if you want to go back and review. Chapter 12, anesthesia, mini lesson 1. Was right here. Our chairperson, Miss Marsha, did this video. So you can always go back and review. For the new students, your ICD-10 coding link is right here. If you don't have the book, so you don't know how to really use the book right now, you can find that. Your CPT link, how to tab your CPT manual. Remember, you must tab your CPT manual. I'll be checking those from time to time. This is the video on how to tab your CPT manual. Everything you would need to know is in this gray section. Your syllabus. Everything that we will be covering for this module 154 is right here in the gray section. Right now, we're on chapter 14. It's giving you all of your objectives. Chapter 14 is right here. It's just telling you from the 1, identify the elements of coding, review the main services, all of the objectives that we covered, everything is right here in your syllabus. When we move on to chapter 15, so if you wanted to move ahead, you can look at the objectives that we will be covering. This module goes all the way to February. So everything you would need to know, your week at a glance. If you want to go ahead and put your assignments and just save them, here's your week at a glance. Day 6 of 40 through 10 of 40. You click on here. Here is day 2. Day 7, I have everything right here. Chapter 13, exam review, 4 p.m. Tuesday, link below, the link for your Zoom class. All of this is in a week at a glance. Here it is right here. That was day 13. Everything that you would need to know is in your week at a glance. So everything you would need is always here. If you go to your news and announcements, I had on here Zoom class today, Thursday for 4 p.m. I had the link, Zoom class. I had the chapter 13 exam 2 review, news and announcements, reminder, our students who graduated, the many lessons, everything is posted in news and announcements as well. And there, I send it. If you don't get it in your email, if you're having trouble uploading, just go into your e-learning. Everything is in your grade section for you to find. So if we don't have any other questions, I will see you all. We're probably going to have, I'm going to do a mini lesson as another review for the exam. We're going to have a Zoom class on either Monday or Tuesday due to us having our last day on Friday before our break. So I'll be posting that soon. Once we come back for the new year, 2023, remember that our Zoom class is every Thursday. But since we're going to be leaving and be off for 2 weeks, we're going to have some different dates that's going to be for next week. So I will be sending it out in an email. I will be posting it in news and announcements. So everyone enjoy the rest of your week. Have a safe and wonderful weekend. Be safe and make sure you pay attention and get those daily assignments in so you can win a prize for perfect attendance.
Thank you, Crystal.
All right. Thank you all. Bye-bye. See you all
Bye.
later.
All right.
Bye.